Hey, 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 this is Dr. Jonathan Shepard on another Friday evening episode of Ask the Doctors. I am so glad that you are with me today. Today is Friday, February the 19th, 2021. We have made it now 6, 7 weeks into the new year. So thankful to be here, so thankful to be alive, even in this new year of 2021. So come on in the room. We have a wonderful discussion. I just want to help set the table, set this foundation. I'm so glad to see that you all are joining in. Hi, Chris. Thank you for joining. And if you are live with me, why don't you go ahead and drop your name and say that you are watching with me. We have such an important topic today, one that I believe that will challenge, inspire, and even give you something to go back and talk to your family members about. So let me just start out like I normally do. This has been quite a week for us in the middle of winter. My prayers and thoughts are to those who are living down there in Texas and in the southern region. I have family in Texas, and even as I spoke with them Monday, their power was out and they were trying to power up their phones in the car, not knowing that they would be out of power pretty much for the entire week. And you know, when you're without power, you don't have heat. And when you are in areas and atmosphere that is below the freezing point, 32 degrees Fahrenheit, wow, that is cold. And I believe as many as 20 people may have died because of the cold weather and not having adequate heat and supplies. And so we want to just send our prayers and thoughts to you all down there in Texas. And now I'm hearing that there may be some issues with clean water, not being able to have just clean water to bathe and drink and to eat from. That is definitely something that is of concern. And so, yes, our prayers and thoughts are going to you down there in Texas. That has also slowed up the COVID-19 vaccine distribution here. Even in Maryland, we had some icy weather that has disrupted people's ability to get out and do things as they normally would do. And so we want people to be careful. This is still winter season, and we want you to, if you have to go outside, please be safe. Please be careful. Please bundle up. We are expecting still some more cold weather this weekend. I am now 1 week after I got my second shot of the Moderna COVID-19 vaccine. Wow. So it's been 1 week now that I've had both dosages. I will tell you that I did experience some mild effects last week Saturday. I did experience a few mild effects. What were those mild effects? I had a slight headache. I did have some minor chills. Nothing that some Theraflu and Advil just knocked right on out, took care of it. And so just want to let you all know that it is important to get vaccinated. It is important to keep on staying vigilant. And one of these episodes, probably next week, we're going to deal a little bit more with some of the myths regarding the vaccine. And I was just reading something quickly about what's called vaccine alarmism. Vaccine alarmism. That is where people are getting alarmed because they're saying, what's the purpose of taking the vaccine? Even after you still have to wear masks and wash your hands. And now some of that stuff is just pure hygiene. But, we have to talk about how do we dispel some of these myths. So again, that's for a later episode. Wanted to give you all a chance to come on in the room. I've got some wonderful guests with me today, and we're going to talk about the mental state of Black America. Wow. You need to get somebody on right now live. You need to go to my Facebook page. Tell them to go to my Facebook page. Tell them to go to Hope Health Systems Facebook page. This is a show's being sponsored by my employer, Hope Health Systems. You can go to my YouTube page, Dr. Jonathan Shepard. And so all these different places you can access this information today, because let me tell you, today's conversation is going to be on it. It's going to challenge you. It's going to inspire you. You might need to even get you a little bit of tissue, because when we start talking about the mental state of Black America, man, we have gone through a lot as a people. And so I want to have some special guests come on to discuss how we're going to survive. We have survived for 400 years in this particular country, but I want to talk about what's happening today. And so with that, I have two prominent physicians, two prominent doctors, I should say. One is a physician, and I want to bring them on because they're going to help further this conversation. And again, let somebody know where that this is going on right now. And I believe that they will be inspired, and so will you. So enough talking. Let's bring on our guest, Dr. Erica Richards. I want to bring her on and welcome Dr. Erica Richards.
Thank you. It's such a pleasure to be here.
Yes. So go ahead and tell us a little bit about yourself.
So I work as a psychiatrist in the Washington, D.C. area. I've been practicing for quite a while at this point. I did some additional training previously in clinical research, which is a whole different discussion about, minority populations and their involvement in research. But I did some training in clinical research, and I did my residency at Johns Hopkins in Baltimore.
Wonderful, wonderful. Glad to have you. Dr. Richards and I, we were on a panel, I think that was last month, relating to overcoming racial trauma that was sponsored by Johns Hopkins. And I was just like, man, we have got to do something together. So thank you for allowing yourself to be available for this platform today. Next up, we have Dr. Kimberly Carr. She's going to come on, and she is someone who I've also been on the platform of panel discussions. I think we've been on the same platform twice. And so again, I'm privileged to have her come and greet us and be a part of this discussion on Ask the Doctors. Dr. Kimberly Carr, how are you?
I am very well. Thank you for having me. I'm very excited about this conversation as my 5-year-old comes in. So I'll go ahead and give a disclaimer. I gave a disclaimer to Dr. Richards and Dr. Shepard that I have a 5 and 2-year-old, so I'll be combating with that. So currently I serve as the Community Resource Specialist at the Georgia Rural Health Innovation Center at Mercer University School of Medicine in Macon, Georgia. Also, I am a 3rd-generation descendant of the United States Public Health Service syphilis study at Tuskegee. So a lot of the misnomers that you hear about the name of the study, Tuskegee experiment, the Tuskegee syphilis study, and all of those things. And during this broadcast, I will take time to dispel a lot of those misconceptions, because intent versus impact, and a lot of that intent of saying the wrong name, it has impact on descendants like myself and also the foundation. So again, we have to be intentional of our language, because language, as we know, speak volumes and it has words. So that's a little bit more about myself, and I'll talk more about my experience, that duality as a researcher, but also a descendant scholar as well in this context.
Wonderful, wonderful. And Dr. Carr, we are with you. All right. So know that as you are caring, this is a wonderful example of how mothers are out there caring for their children in the midst of this pandemic, and actually it's going to be even beyond this pandemic, and how mothers are multitasking. And so we applaud you, Dr. Carr. All right. We applaud you. All right. Please know that. And so we're supporting you even as we go through this conversation. So yeah. So let's go ahead and get started. Let's jump into this. Yes. Yeah. Come on live. Yeah. Unmute yourself if you don't mind, Dr. Carr. And who is this that we have?
Say your name.
My name is Martez.
How you doing, Martez?
I'm doing good.
Wonderful, man. You're on a broadcast with us on Ask the Doctors. Yeah, Mommy's doing a wonderful job.
I was at school.
Oh goodness, she's gonna start talking a lot, so I'm gonna unmute.
All right. Oh man, I love it. Dr. Richards, why don't we get started with you? And so, some of the questions that we've been discussing and kind of going back and forth are, Just describe the work that you're engaged in combating the stigma, health disparities, and lack of access to mental health care within the Black community. Now, remember, we're talking about the mental state of Black America. So we're kind of just jumping right on in that there's stigma, there's health disparities, lack of access, these things that we already know exist. So describe the work that you're engaged in combating those three things.
Sure, and that work is really multifaceted. I would say during the pandemic, it has been more outreach to educate people about depression, to educate them about anxiety. There's been a lot of recent surveys. There's been a CDC Pulse survey recently that has said, look, most households, when they're polled, they're going to report increased anxiety, they're going to report increased depression. And we're seeing that if we take those numbers that we're seeing during the pandemic and comparing them to a year prior, we're seeing increased numbers. In addition to that, we're seeing it go up, unfortunately, as the pandemic continues. And so part of what people need is to understand that they're not alone, to understand that there is anxiety out there. And that is very much specific to our community. It is telling everyone that, look, yes, you might be home with kids, you might be working from home, you might be going through this, and you might be struggling, and you're not alone, right? We're all dealing with this. And so part of what I see my job is to educate and to normalize this, to say, let's talk about it, right? And to understand what the interventions are, to understand that there is a sounding board for this, and to give some examples about where you find that assistance. So that's one of the things that I try to do. With a group of my colleagues here at Hopkins, we also published recently that that numbers of providers of mental health, specifically psychiatrists, are lower, right, than we are in the population. And so what I love about my job is that this gives me a forum, again, really talk to people about mental health, and to know that that is not often the case, that they can see someone that looks like them, that may be culturally similar, and that can really talk to some of those experiences that people have.
Yeah, absolutely. That's great. That's great. So again, you've laid out a nice framework here for us to get started on, because again, we're talking about the mental state of Black America. And so I want us to comment on what we think the mental state of Black America is right now. We know that there's stigma, we know there's health care disparities, we know there's lack of access, and these things existed before the pandemic, right? These things are not new, but it's interesting to see how your work is engaged in that. Dr. Carr, same question to you. How are you engaged with your work in helping to overcome these three things that we've talked about: stigma, lack of access, the healthcare disparities?
And here comes the 2-year-old. Perfect timing. Hold on. Let's go fish box very quickly. So with that, the beautiful part about it, and I think we often leave out most of the time in the Black community, or just the Black population in general, is the geographic differences. So I'm definitely in the rural space, and I'm in Georgia, and I'm going to give cultural context of that. So I'm Georgia. That is a Southern Black Belt state. That's one of 11 Southern Black Belt states. And I'm not unsure. I'll go ahead and explain it. Southern Black Belt is a cultural context. One, if you look at it from W.E.B. Du Bois, from Souls of Black Folks, 1903. As the high concentration of Blacks. And or you can look at it from Booker T. Washington as talking about the rich, fertile soil. So in Georgia, I'm working in those rural communities. And in Georgia, out of the 159 counties in Georgia, 120 of them are rural. And of those 20 rural counties, a lot of them have a large minority Black population. So that's just that right there. These, and we're going to talk in the context, these are the descendants of slaves, descendants of an exploitative and racialized agricultural system. Because when you automatically think of rural, you think of agriculture. You think of the other stereotypes of poor and all of those things, which goes into the study. So in my work as a community resource specialist, I help to increase the effectiveness of different initiatives as it relates to the strengths, the needs, the disparities as it relates to rural healthcare. And specifically in the Black community, it's funny because we are in the midst of putting together a mental health project in one of the counties. And in one of the counties, it was remarked in a report how we're set up in different public health districts, is that there is an uptick of suicide. There is an uptick of anxiety. There is an uptick of depression. And we are talking about a lot of these counties, they have issues with transportation. They have issues with healthcare providers. There simply aren't any. Or the fact that for any type of mental health provider, you have to drive 30 to 45 minutes to the next county and hope that they can see you. And then now that we hear telehealth is amazing. School-based health is amazing. But when we think about telehealth, when we think about it in the rural community, we have to think of broadband access. So there are a lot of factors that play into the health disparities, that play into the stigma, that play into the lack of access of providing all across the board. So we have to think about the broadband, rugged terrain, how can we get access to there? We have to think about different factors like poverty. We have to think about different factors like food. So when we talk about access, and I always say that many times in our fields, we do things in silo. And what puts me in my position is I have to look at it comprehensively, and all these factors together play into that mental state. For example, with rural populations, two things: you're dealing with social isolation and you're dealing with loneliness. And then you're dealing with no healthcare providers to help you at all. And you have to travel. What if you don't have transportation? So we're already fighting against a lot of factors, out of our control. And with my center, we're trying to think of, and we are thinking of, innovative ways to bring in, the medical school, to bring in different providers, to bring in health systems to these counties who simply do not have mental health providers, don't have obstetrics and gynecological care. Like, it's nothing there. So this is, again, where our center comes in, try to fit and meet that need as much as we can.
Absolutely. Absolutely. Dr. Richard, do you want to comment on anything that she said?
I think that's a key point. And there's so much isolation that people can feel. And Dr. Carr really illuminated a lot of different issues. When I compare what we're experiencing now in the pandemic, it's almost the same concept, right? People can say I'm isolated because I'm home alone and I'm doing, virtual work, and I'm not, I don't have a significant other, or I don't have other people I'm responsible for. But then we're seeing the same amount of people that do have those things that are also feeling isolated. So it's very similar to what Dr. Carr is saying. There are some instances where people have lack of access because of distance alone, because that they can't find anyone. But similarly, I am in the city, and we're seeing the same thing essentially, which is for different reasons. Either they don't trust the medical system, or they don't have doctors that look like them, for many reasons, right? There's still people that are saying, I don't have anyone to talk to. Nobody can help me with this. And that is that feeling of despair that really we want to tackle. We want to educate people that this is how you get there. And that's what's important.
Yeah, absolutely. So what we're doing for those who are out there today listening, and I want to make mention of those who do watch us on replay. Thank you for doing that. And so in doing so, we are now discussing the mental state of Black America. And just in these first 10 minutes, we've discussed how it looks different in the urban settings versus the rural settings, and how the two actually are very similar. I wasn't even thinking about that as we were discussing how we were going to shape this conversation, but wow, that is interesting to hear that even in the different settings, whether it be in the Southern Bible Belt, whether you be up north in the urbanized cities, if you want to use that term, it is very similar. We're going, I hate to say, out of our mind. I'm very careful of the words I use. But let me tell you, as a Black person today, you feel the weight of the stress. You feel the weight of the anxiety. we were discussing prior to this. I think this is a good place to go. I was reading about Dr. Dina Simmons, and let's just talk a little bit about her. Dr. Richards, why don't you just start us out? Just talk a little bit about what happened to Dr. Dina Simmons, and then Dr. Carr, I want you to respond like, how would you have handled this situation? You all have got to hear this, about Dr. Dina Simmons from Yale University.
So I think the details of the story are still coming out, but my understanding essentially of what's happened is that she was kind of a major player in the education scene at Yale and was really trying to work on diversity initiatives. And it sounds like that was absolutely not met with understanding and acceptance from some of her colleagues, from some of the students there. And I think one of the last straws was, at least from the information that I've seen, was that she was on a Zoom meeting, and really there were people that were coming on and saying inappropriate things to the point where there were racist statements that had been mentioned. And she kind of left that meeting, but was encouraged to come back, and it continued to happen again. Now, it sounds like that was one of the main things that's happened more recently, but she also alluded to a lot of microaggressions during her time there, from everything from people wanted to touch my hair and wanted to know what was going on with that, to people indicated that the only reason I have something to say is because I'm affiliated with this institution, not because I might have something to say for my own merit. And so I think that there's a lot of issues that were there appropriately, and she said that it's just, I can do more work outside of here. I don't want to try to fight this particular uphill battle because I can reach more people if I leave and do it this way. And so she sounds like is going to go out on her own. But one of the important things that she said was that if I go out quietly, nothing is addressed and nothing changes. And so I don't want to be kind of, I want to lead the change, even if I'm not going to be here. So I have to speak out, and I have to let people know what happened to me was wrong, and these are the instances where it happened.
Wow. Dr. Carr, comment. How would you have handled this situation?
So this is my first time hearing it, and I was like, is this my experience? Because I can tell you I was a postdoc at Michigan State University in two centers: the Center for Regional Food Systems, which is in the College of Ag and Natural Resources, Department of Community Sustainability, and in the Center for Interdisciplinarity, that's in the College of Arts and Letters in the Department of Philosophy. So my research was in food sovereignty and racial equity. I was the only Black person in both centers at a Big Ten school. Only Black person, only Black woman. And the amount of things I've seen, the microaggressions, working with colleagues who I've been there for at least 3 months, and then they laugh off, oh, it's hair. There was one particular microaggression in general where one of my colleagues thought I was someone else because we had the same hair, because it was curly. And I was thinking, are you kidding me? So I understand that on that level. And then when you're talking about equity, and you're talking about equity in the food system and food and agriculture, where, whites have profited from land dispossession for exclusionary practices, from all of those things. And then I have to come in and be who I am and tell you need to be fair. Trust me, I understand it 100%. Because when you're talking about equity, you're talking about distributive justice, and you're talking about a population that has that's more socially, historically disadvantaged from land that they took, to a population that is less historically and socially advantaged because of the more socially historic advantage. So I understand that 100%, and I would tell my colleagues all the time. I don't get to take off my equity. I don't get to go home at 5 o'clock and say, whoo, check that off today. I don't get that, because I'm only protected by Michigan State between 8 and 5. But after that, I'm just like the them. There's this terminology, us versus them, where I still have to walk in this duality of them. And my colleagues, they tried, but again, they have a privilege, an implicit privilege that they don't understand that they have, and that's hard. And I remember I told myself, my job here is not to teach them along the way because there's enough information. So my heart goes out. I understand that on every level. And it's funny, I felt that I had to go all the way up to the Midwest to experience racism, or I'll say, well, microaggressions or implicit biases. And I'm down, raised in the Deep South. So I get it 100% being in the sea of many and people not understanding truly. Because again, some people think equity is a buzzword and not a lived experience. So I get it. I get it.
Wow. Dr. Edwards, you want to comment on anything she said?
No, I think Dr. Carr is absolutely right. These are the issues, right? It's gender, it's race, it's culture. And if we pull that back to the discussion about kind of the state of mental health in the Black community, there's two sides to that, right? There's the providers that are trying to make things happen, but are still going through this, you know, with colleagues, with promotions, with that sort of thing. There's that strain on, you know, what we see also in the publication that I mentioned, looking at psychiatry faculty. What we see is that even if you look at residents versus fellows versus people that stay in academics and do research and really train those that are coming behind us, the numbers continue to go down the longer you have to stay in academics. And there's many reasons why, right? The pay is not necessarily the best compared to doing private practice. There's a lot of reasons why, but when you look at that, you're saying, listen, on this side, the provider side, there's struggles. And then, you know, culturally with our patients and the people that we're helping to treat, they're going through the same things, right? I mean, this could easily be a session or someone in therapy saying, guess what happened at work for me today? And it helps when that person you're talking to can say, oh, I get it. Yep, that happens. And how did that make you feel versus someone that may say, oh my, what? That happened? Do you really think that's what they meant? Do you really think that's why they wanted to touch your hair? So it's, again, important for us to be able to talk with people that look like us.
Yeah, and you know, I mean, I even think about what's happening, you know, with Dr. Carr. You know, some people will be upset. Some people will be like, you know what, she got to go. You know, how is it that she's going to be on a broadcast and her children may interfere? And, you know, and I've seen where people have gotten fired because of that. Isn't that something? One of the things that has happened for me is that I, you know, have had a greater appreciation, and I have no problem with admitting this. During this pandemic, I've learned to appreciate the Black woman at a whole nother level. And those who have watched me evolve with the broadcast, they will know exactly what I'm talking about, because I have watched not just Black women, but I've just watched women, how they have had to be able to carry themselves during this pandemic, having to be the mother, having to be the wife, having to be the sister, having to be the caregiver, and yet maintain some type of profession. And that is hard to juggle. And so we've been talking about, this particular woman, Dr. Simmons there at Yale University, but how many of y'all out there, you could identify with her? I mean, that's what Dr. Carr is talking about. That's what Dr. Richards is talking about. This is the mental state of Black America. We're so busy trying to juggle so much at the same time and yet trying to live. And then we throw a pandemic on top of it that has disproportionately affected us, not because of any fault of our own, but because of the stigma, because of the lack of access, because of the healthcare disparities. Yes, those will play major factors into why our communities have been hit so hard. So let me just pivot right there. The word stigma, and this really drives home the point. The word stigma is defined as the interplay between power and negative stereotyping. Wow. The interplay between power and negative stereotyping that results in a devalued group who are vulnerable to marginalization. Wow, that is us. All right. So we've already talked about the power. We've talked about the negative stereotyping and that interplay. So what I want to go to now is, where did the stigma associated come from? the stigma is associated with mental illness, the hesitancy in our Black communities to seek treatment. Where did that originate from? And Dr. Carr, I think I'm gonna start with you, so you can tell us a little bit about your family, because this is in part where some of this stigma and hesitancy comes from.
Yes, thank you. And for the listeners out there, I will give some more premise. I am a third generation descendant of the United States Public Health Service syphilis study at Tuskegee. And that title is probably a title you probably have never heard of, or maybe you have heard some remnants of, but the other misnomers, Tuskegee experiment, was actually had everything to do with Tuskegee Airmen. That was the Tuskegee experiment. And then to call this this so-called study an experiment is laughable, because there was no written protocol. They were just out there doing a research project. That's what it really was. Because the thing is, the actual title of the study is a Tuskegee study of untreated syphilis in the Negro male. And if you look and ponder on the intent, it said untreated syphilis. So the misconceptions that, the men were injected with syphilis, I can tell you one thing, the government is very intentional. Untreated, that means they got no treatment. They were interested in the natural progression of syphilis in the body. And those men, my great-great-grandfather, who was buried for $25, was given $25. Our family was given $25 for burial. He was more wanted dead than alive. He was more valuable dead than alive. So about this study, it was a 40-year study from 1932 to 1972. It included over 600 men, 600 and counting, because again, the United States Public Health Service the United States Public Health Service did not keep record. And another thing that people don't know is that after USPHS investigated, it was then transferred over to the CDC, known as the Communicable Disease Center, in the mid-'60s. So the CDC had their hand in it, even though we say USPHS. So it took 40 years. The men were victimized or coerced. Again, the counts, depending on who you ask. They were not given treatment when treatment was available to them. Treatment was available in the form of, and I'm trying my best to calm down, because I think of my great-great-grandfather, and I'll just pause very quickly. When we talk about stigma, we talk about health, we talk about disparities, what we're really talking about are the social determinants of health, right? These men were essentially preyed on by their income. When you said power, I thought of that is what health disparities are rooted in: wealth, power, and prestige. And if you down and you operationalize it, you're talking about income, you're talking about education, and you're talking about occupation. And if you put it in the context of the study or research project that was being conducted, those men, they preyed on them because they were Black, because nobody cared, and they were poor, and they were tenant sharecroppers. And that wasn't all the way true. My great-great-grandfather, he was a biracial man. His mother was Black. His father was white. And during that time, his father knew that, the times would be against him. So he gave him land. And my great-great-grandfather, he had money, he had wealth. He had the cows and the chickens and horses and all of that. And if that translates to a Cadillac and all of these, different symbols of wealth. And he wasn't, an alphabet. He wasn't illiterate. He was a clergyman. He was also a farmer. So that goes into my passion of agriculture and everything else. And what you're sitting and seeing right now is the legacy of John Good. So the study was broadcast to everyone in 1972 by Jean Heller, and it was on the front page of the New York Times. I'm going to get it right, I have my notes. And it said that, excuse me, I want to get the correct title so I don't perpetuate any misconceptions. But the actual title that was on the front page of the New York Times was "Syphilis Victims in the U.S. Study Went Untreated for 40 Years." The interesting thing about that was the study was widely known. It wasn't one of those things that, the public health community or research community didn't know about. There was a whistleblower by the name of Peter Buxton. He tried his best to tell everyone about it, and no one cared. They turned a blind eye to it. So he leaked the story to the Associated News reporter, and she broke the story to the New York Times. It was a great thing, but at the same time, the syphilis study at Tuskegee became symbolic of this historical injustice. And for the first time in 1997, when President Bill Clinton, apologized for the wrongdoing of the government, this is the first time a sitting president ever apologized to Black people about anything, people started to hone in specifically on this. That's why Blacks do not want to participate in clinical trials, which is not true. And that's another negative legacy of the study, right? That Blacks don't participate. And that's not true. Some, a researcher, Ralph Katz et al., they conducted a study to see if that was true. And the conclusion, it wasn't. There was a reluctance, but they were willing to participate in this. But there were other things of this 400 plus year history, and then you choose this one. And I understand it's symbolic. So an implication of the study was the first presidentially mandated bioethics center, the National Bioethics Center and Research in Healthcare at Tuskegee University. We have a Descendant Foundation, Voices for Our Fathers. Descendant Foundation, we have our own website. It lists all of the men on the study. You can see them by name. My great-great-grandfather, I have permission from my family, he was a syphilitic. He was in that group. He was patient or subject number 212. So as we talk about stigma, we have to be careful as Black people to not perpetuate these misconceptions. And we have to be careful because we have living descendants like myself that have to come on Brock as different news outlets, NBC News. The president, she just did an interview with ABC Nightline News. You can Google that. Her name is Lily Head. And we have to continue to do the work, undo the work of people, us, saying Tuskegee syphilis study, Tuskegee experiment, while re-victimizing our own selves. How does that put in the mental state of those inhabitants in those surrounding area of those people that live in Tuskegee? Oh, you're the syphilis people. And we do that to ourselves, not thinking that we're conditioned to say it's those people, but it's a part of our community. And we have to be aware of that language. So for me to stop soapboxing, we have to be careful for our own selves to not re-stigmatize and not use just solely Wikipedia, as our source. Because then when you come into contact with someone who doesn't know about the Tuskegee syphilis, but some people don't even know that Tuskegee, believe it or not, is an HBCU. I've come into contact with people. Wow. HBCU, what? Oh my goodness. And then they're going to automatically equate. So again, we have to just be very careful of our language and be cognizant of our tongue. And I'm saying that among Black, we need to hold each other accountable for that. And that's wow. My perspective of that.
Right. I mean, what a powerful story. And a few things. I think one of the biggest things that you mentioned was, right, this is research. And this is what a lot of people feel about research. This is what a lot of people feel about access to care. And what you said about victimizing, we could talk about the COVID vaccine, right? In the same situation where we say, look, we understand why, groups of our folks don't trust the government, don't trust the science, and are hesitant to move forward with even the vaccine initiative. And to go back to Dr. Shepard's question, absolutely, it's the same concept with the stigma associated with this. Dr. Carr highlighted it. The first thing you have is lack of trust, right? And that goes down to, what am I going to talk to this doctor about? I don't have anything in common with them. Or why do I want to go talk to this therapist? I don't have anything in common with them. They don't understand me. And who knows what happens with that. And it does go back to research. I mentioned about time I spent looking at clinical research. Numbers of our inclusion in research is down. Now, luckily, there are a lot of funding opportunities now that say we will not give you money for the research unless you tell us, how are you including women? How are you including minorities? Because the concern is that all we know moving forward about science is how this affects, white males. And that there's hesitation to doing that. Now we understand it, and so science and healthcare have to move forward with saying, how do we address this with all populations? And really, that's what's highlighted with what Dr. Carr presented. How do we, not only the apology, I mean, the apology is a good start, but how do we then say, and here's how we don't let it happen again?
Yeah, absolutely. Very well stated. And again, we thank you, Dr. Carr, for even just exposing yourself and making yourself vulnerable, your family vulnerable. So we do not take that lightly at all. And so please know that you have our deepest regards in how the government treated your family. And you said something that's just so key. Why do we keep victimizing ourselves? It's like we keep shooting our own selves in the foot. It really bothers me, especially when we know that people are going through, and we already know the weight that it carries to be a person of color within this community. But yet we choose to pick on those people who are already marginalized. It really goes back to the definition that I was talking about regarding stigma. And so thank you, Dr. Richards, for bringing out that word power. Because I'm sorry, maybe Dr. Carr brought it up, but there is a power gradient that is there. I tell you, power is something that if you don't know how to handle, you will misuse it, you will abuse it, and that's what happened. People, there's already a power gradient when people go to see the doctor. Think about that. There's already that power differential. And now here you're telling me I got to trust somebody where I already don't feel comfortable or on the same level of being able to share with what's going on. And now you already have this negative stereotype about who I am. My God, that's where stigma derives from. And then it devalues you. It tells you that you're not the person who you think that you are. It tells you that you're less of a person. And so I hear you, Dr. Carson. Thank you for breaking it down like that. And we have to be careful that we do not re-injure ourselves. That is the mental state of the Black America. Oh, I'm gonna keep pushing it now because we have to be so mindful of what we say to one another. We have to be so mindful of how we treat one another. And so again, I go back to that statement I said earlier about with Black women and how I have to make sure that I don't lessen or don't show as much appreciation as I should, because they're the ones who are carrying so much. It is something to be a Black man in this country, yes, but it's also something to be a Black woman. So again, I'm gonna leave that alone. Anybody else want to say anything about how this stigma originated before we pivot to the next question?
Well, I mean, there's some schools of thought also that, if we take things back to even times of slavery, right? What happened to the weakest people, right? They were either killed or sold. And so there's this frame of reference that says, listen, families in general rallied around their ill. They rallied around those that were either physically, mentally, ill or both, but they didn't really ask for help. They wanted to hide it because the thought of highlighting this meant we could put a target on our family. They didn't want to lose their loved ones. So it is quite possible that in some way has carried over with generations to say, no, we don't talk about that. No, we're not going to say that. Which does us a disservice. But Dr. Shepard, you also mentioned, talking to people and what we say matters. And that's the same true on the brighter side, right? I mean, I love when I hear people say, well, I needed to talk to my therapist about this. Or, when my, fill in the blank loved one had depression or postpartum depression or anxiety, here's what we did. And so I can tell you right now, it is absolutely happening in our community. We're not immune to it, to mental health. And so the more we talk about it, the more we share our stories, the more we have forums like the one you're providing today, then the easier it is for people to say, listen, this sounds like, me or my friend, and let me figure out how I get some help here. And decreasing the stigma is the key.
Yeah. Dr. Carr, you want to respond to any of that?
I had a thought, but she said it so very eloquently, and I agree 100%. And I thought of my great grandfather as well, especially in the country, because if you had any type of ailment, for the most part,
Hmm.
they kept you away and they shunned you away. My grandmother was the oldest of 10, and she cared for, we call him Big Daddy. She cared for him all the way until he became this prune of a person. And, again, when you have something, like syphilis, which is for the most part very sexual, a sexual disease. I spoke with my mom and we talked about it. She said, well, we don't talk about disease, especially in the country, because again, that's a sin. And it was like one of those things,
Mm.
punished for your sin. You should have been doing it anyway, regardless of.
Wow.
Then another thing that we don't talk about is what happened to those women. I mean, I know we talk about the men, but those women was just as victimized, because especially in those times, they couldn't just go and say, yep, I'm about to go put in an application for a job. No, they had to stay home, and get it themselves. Many of them did, and then pass, because it's congenital, and then you pass it on to your children. So what happened to those women? We don't know those stories just yet, because there's still the stigma of us talking about it. And I know old folks don't like to be called old folks, but the old folks don't want to talk about it. And I know our family didn't talk about it at all. They kept him where he was and said that was that. And I agree with everything Dr. Richards has said. Yeah.
And so this is what is called racial trauma. All right. So we want to look at what racial trauma means and stands for. We're just giving you examples, but let me just give you the definition. It's mental and emotional injury that's caused by encounters with racial bias, ethnic discrimination, racism, and hate crimes. Wow. I'll read it again. Mental and emotional injury caused by encounters, and we've been talking about these encounters today, with racial bias, ethnic discrimination, racism, and hate crimes. Wow, that's what racial trauma is. And so this is what is part of the mental state of Black America. We've been traumatized. And I've talked about how we have to be careful that we don't be the ones who are the accusers, or don't be the ones who are perpetuating the racial trauma. So what I want to do is, we know that racism exists. We know it continues to exist. We see it every day. But how can we as Black Americans heal from this racial trauma? How do we take what we have been talking about today, and how do we begin to mend and heal from this trauma? Who wants to start out first?
I'll say a little bit, because I know I'm very limited in my mental health, because I'm not a provider. But
great job.
Is that you have to recognize that you've been hurt. That's and this is speaking from personal experience. You have to recognize that you were hurt, and then take accountability for your hurt. And that's the thing. We again have been traumatized. That is them point out. But at the same time, we have to hold ourselves accountable for our own healing journey. And in order to have that accountability, you have to confront that hurt. And a lot of us don't want to, because we have other things we have to worry. I have to worry about racial trauma. Now I got to worry about how my bill's going to get paid. Now I have this, this chronic ill. I have all of these things. That's another thing that, it's like a house of cards. If I just think about that one thing, how do I not know? I'm just going to just have a nervous breakdown. So sometimes you just mentally block, and it's just, you're just adding these different cards. And that one card could just be the one that can knock everything out. My other thought is, I think of Timothy Wright's, it's a gospel song, Trouble Don't Last Always. We've been making for a night. So it's one of those things. If you are a person of faith, find some type of coping strategies. But at the end of the day, you have to be accountable for your own feelings and recognize that there is a problem and that you want to fix it. And get out of the house of cards and go build something else that is not as shifty. And that's my thoughts on that.
Wow. I like that. Go get out that house of cards. I'm going to use that. Dr. Richards.
Right. I think what Dr. Carr said is absolutely right. I mean, the question is, what do we do, right? How do we cope? And to that point, right? Trouble don't last always. You need that ending in sight, right? The finish line. The issue, and I've often heard too, the coronavirus pandemic as, one of the biggest issues being that it's called a disaster of uncertainty, right? We have really no idea when it's lit. And that is why people struggle with it so much, right? If you think about how the streets looked, back in April and May, they were empty. People were following, at least, I don't know about Dr. Carr, I'm not gonna go to this out. But, in DC and Maryland, which I can speak to because I saw, people were staying home. People were wearing masks. I mean, we were following the rules for the most part up here. And it's funny because it was like, okay, we can do this. We can rally. We can do this for, what's it going to be, a month, 2 months? People were okay. But the disaster of uncertainty meant that, wait a minute, at month 6, we're like, what on earth is happening? And I draw that because, I draw that parallel because a lot of people really could refer to the systemic racism as the same concept. It is a disaster of uncertainty. When will we be treated fairly? When will this not be one of those stressors that people are citing and seeing? And it's the same concept. Maybe we could generate a plan. And there are people that are generating plans, right? But you have to realize that sometimes there are uncertain endpoints. And so you have to start to come up with your plan. The same way we did with the pandemic is the same thing we have to do with the way we're being touched by racism, right? I mean, people were torn when George Floyd died. What do we do? Do we go out and protest and risk catching coronavirus? Do we stay home? I don't know what to do in this situation. And that was even stressful for people. That was stressful for what people wanted to teach their children. What do I tell them? I want them to see this. I need to take them to see this, but I don't want to put them in harm's way. And so the anxiety started to increase even more. And so it is one of those things where, again, by talking about it, by introducing the subject matters, I think people are starting to feel more comfortable with voicing their concerns and really coming up with plans for how to address it.
Right. Now, I like how you labeled the coronavirus or the COVID-19 pandemic as the disaster of uncertainty, and then made the similarity with systemic racism as the disaster of uncertainty, if you would, because we just don't know. And I can hear you all out there. I can hear that Black male. I can hear that Black female. I can even hear those who are not Black who are saying, when will this end? And it is that uncertainty that fuels that hesitancy that we talked about. It fuels that, why should I go and spend time talking to somebody when I don't know when this will end? Will it ever end? Will it ever make a difference for me? Will I ever get better? Oh, I hear you. Oh, I'm all in your house now. I know that that's what many of people are thinking, because even though we're in 2021, who would have thought that we would continue with the same mandates, with the same guidelines, with the same restrictions in place? And now you're telling me I have got to get a vaccine in order to be able to return to some type of semblance or what I used to be able to do in my life? Oh my God, I hear you out there. And so this is what is going through our mind. This is the mental state of where many Black Americans find themselves. This is the emotional state. Even as I'm saying this now, I think about the emotional highs that so many of us are having. And what I mean by the emotional high, I don't mean the good stuff. I'm talking about the high anxiety, the anger, and the apathy. The 3 A's that I talk about. Those things are real. But with all that said, listen to what has been said, how we can heal. How do we move forward? Recognizing, yes, we know that these are uncertain times, but recognize that it's okay to say, I'm not okay. I'll be honest with you, and I want somebody to speak to this. Last year, was a rough year for me. It was a difficult year for me, probably one of the worst years I've had since I've been living. And one of the terms that I adopted was I was functioning, but I'm not okay. That was really me last year. I was functioning, but I was not okay. And you might say, well, what do you mean by that, Dr. Shepherd? I was not okay with what was happening in the world. I was not okay with what was happening in my personal life. I was not okay with what was happening in my professional life and the different arenas of my life. I was just not okay. And even in being not okay, When I finally admitted it, that's when things started to get better, because I started to see how I could begin to bring some type of order in those areas that were going in disorder or not functioning. Someone speak, or comment to a little bit about that, about functioning but not being okay. Is that part of the healing process? Dr. Richards, I see you shaking your head.
I think it is part of the healing process. It's part of acknowledging, right? The question is, if I close my eyes, I can't see you. Are you still there? It's the same concept. We have to address these things that are before us. And so, to bring the discussion back, we talked about being complicit. We talked about speaking up when things aren't right. And I think that there's, to Dr. Carr's point, when we talk about our ancestors, could they ever imagine, right, that we would be here in this situation? And so we won't know the full impact of what we do. We have to, live lives that speak to our beliefs, that are ethical, that, call out injustice. And even if we don't see that change, right, education, talking about the things that we said are tough to talk about with mental health and prior experiences of our family members and friends, but all of that we have to believe will make a difference to the future generations, to the people that come after us.
So Dr. Carr, I'm going to save this part B of the question for you, because Dr. Richards, thank you, because you made excellent points. Is it possible to heal? So I've talked about, what ways, and when you all have talked about it, I asked the question, you all talked about it. But now I ask, is it possible to heal? And I asked that question for you in particular because of the descendants that you are a part of. Your ancestry. Let me say it like that. You're a part of people who were purposely, intentionally hurt. Is it possible to heal knowing that racism is going to continue the next day that you wake up?
It's funny that you say that, because each year there is the annual the commemorative of the apology, and then there's a public health ethics intensive, and that's every year. Well, it used to be in March, but because of the pandemic, and the very first day is Family Day of Healing. The very first day. And then that's during that time, as it's in, we all come together across the country is where we are. And we come together and we hold a memorial, right? And then we come in and we have a church service, and we talk about, how are you? Do you still feel X, Y, and Z? And we make sure that we still stay together in that, and make sure we have those checkpoints. And I think with healing, it's like if it's a strategy or initiative, you have to have benchmarks to your healing. And it's a continuum, but you still have to check in to see where you are, because healing is not a destination, it's a process, it's a journey. So I think it's definitely it's possible in healing, but at the same time, you have to have those checkpoints to see where you are in your baseline.
Agreed. It's absolutely possible. I mean, we see it every day, right? We're a resilient group. So it absolutely is possible. And some people can even do it on their own. Others should reach out for help when they need it, but we are resilient, and the healing absolutely can happen.
Absolutely. Well, thank you, because that's what I want to end on. I want to end on the positive note. I want to be able to give people that encouragement, because the mental state of Black America is a complex question, because we're a complex people. And even as we started out talking about the difference between the North and the South, that just really kind of developed before my very eyes, not even knowing, thinking about that before actually the session started. But let me tell you, we are resilient people. So thank you for saying that, Dr. Richards, Dr. Carr. What I want you to do, and I want you to give some closing words, speak to the hope, speak to the future, if you would. I want you to speak to, how do we maintain our mental and emotional well-being during this time? So I want you to get your words together. And then after you do that, I want you just to tell people where they can reach out to you. If they have some more questions, more information they want to. I know, Dr. Richards, you are a physician. If people want to be able to, I don't know if you're accepting new patients or anything like that, but at least you can let us know how people can reach out to you. So let's see. I started out with Dr. Richards first, so I'm going to start out with Dr. Carr now to give out your concluding statement and how we can contact you.
Yes, as I said before, trouble don't last always. And I think for me, that's just that. It doesn't last always, but also in this these uncertain times, I had to realize my own limitations and have a mental health break and a mental health rest. And it's okay to rest. And I think in many ways, especially Black women, we have this superwoman syndrome, not because we always want to step into that role, and then oftentimes we have no choice. But, you know, just to take a break, reflect on yourself and move forward. I can be contacted at, I'm going to give my email address, car_KN at georgiaruralhealth.org.
Okay, great. And I'll get a chance to put that into the comments section. All right. Go ahead, Dr. Richards. Thank you so much, Dr. Carr.
So it's been my pleasure to have this discussion. I think these are important topics, and moving that needle forward, right? Moving it towards progress is where we've been, pushing that boulder the whole time. There's lots and lots of options available, from talk therapy to, if necessary, medications, talking about what may be keeping you up at night with sleep. And it will be different. It'll be different for people, but the concepts are the same. And when we talk about needs, we talk about concepts. Less important why you're not sleeping at first. What's most important is to get you sleeping, and then we start to pick apart what caused it. And so those are the things that I want people to understand, that there's hope. There is hope in general, but also we are, I think, on the upswing with both pandemics, and we're moving in the right direction. So that's the most exciting thing for me. In terms of accepting new patients, our clinic, unfortunately, is not at this time, but what is most important for you is to reach out. A lot of people say, oh, the wait times are so long and I need to see somebody, but I can't find anybody. And those important concepts are absolutely, there are clinics available, depending on what state you're in, that will have fee for service programs, which means that even if you don't have insurance, or if you don't have mental health options with your insurance, that sometimes they will look at what your income is and they will come up with an appropriate amount that you can contribute. If you do have insurance, you can always go through your provider. A lot of times they have carve-outs for mental health where they can even tell you who locally will take your insurance, who are doing things virtually if you're afraid to still go into clinics. So there are a lot of options available.
Yeah, no, thank you for saying that. I appreciate that. And yeah, I do know that a lot of people are booked up, because let me tell you, mental health is at a premium right now. And at Hope Health Systems, where I'm at, 410-265-8737. That's our intake number. Please, we still have availability, 410-265-8737. We'll do you some good. That's my slogan. But we'll take care of your child, your children, adolescents, and adults. We take care of even geriatric patients. And so please come on over. But Dr. Richards is absolutely right. It can be difficult to find. Let me share with you just one little point that I've learned over the last couple of months, is that really stigma. We've talked a lot about stigma today. But guess what the biggest factor is in stopping people from getting the health care or the treatment that they need? It's not stigma anymore. It's cost. We're doing our job with stigma. We still got to combat it. I'm not saying that that is eradicated. I mean, that's the purpose for one of the major purposes for the shows. But let me tell you, cost is keeping people from getting the health care that they need, and that's because unemployment is so high. Or if they are employed, their employer is not offering health benefits because they're partially employed here. They're trying to make ends meet because they're working 2-3 jobs just to be able to make ends meet. That's why our current president is trying to lift the federal minimum wage level, because people are living below the poverty line. And you'll be amazed at how people are living, even within our state of Maryland. How many people are making under $50,000 a year when it takes $87,000 some a year for a family of 4 to live in Maryland? Isn't that something? It costs that much money, but yet most folks are making under $50,000 a year. So that gap right there is huge. And so, yes, cost is what's playing a large factor as to why people can't seek out treatment. So please listen to what Dr. Richards said. You know, don't give up. See what resources are out there. There are some organizations such as NAMI, N-A-M-I, who will fight for you. There are other organizations that you can contact and within your local groups, within your local organizations, within your counties, so that you can get the mental health care that you need. And then I'll end with this, with resiliency. Resiliency means that you can bounce back. The thing I love about resilience is when you start somewhere, you drop and you fall, you don't bounce back at the same level, you bounce back higher. That's the thing I love about resilience. So remember, if you fall, you can bounce back, but let's not bounce back at the same level. Let's bounce back higher. This has been awesome. Man, I have enjoyed this discussion today. We've gone a little bit longer than we normally do. We normally do about an hour, but it is worth it. Thank you, Dr. Richards. You've been wonderful. It's been a pleasure talking with you. Dr. Carr, thank you. Mommy, yes, and thank your two sons in the background. they have kept it live today. And again, Hope Health Systems, 410-265-8737. Dr. Richards, Dr. Carr, please hang on. I'm going to go ahead and end the show. Please remember the 4 W's as I end out our show so frequently with: wash your hands, wear your mask, watch your distance, and then wait on gatherings. We got to still wait because we got to get more people vaccinated. And hopefully, you know, by the end of this year, I won't have to utilize those 4 W's anymore. But again, blessings to you all out there. Please stay safe and catch us next week. I'll have my friends back with me, Dr. Draza, Dr. Griffin, and we'll have a special guest with me. Again, Ask the Doctors broadcast. Thank you for all those who are watching the replay. I want to thank you all. We get so many people who go back and watch this. At least triple the number of people who watch live will go back and watch the replay. So thank you all for your time and effort, and have a good night.